Breast reconstruction with an implant can be performed in several ways. Most commonly, I perform this reconstruction at the same time as the cancer operation. Some women, however, have decided to wait after their cancer operation, and so occasionally I perform this type of reconstruction months or years after the original surgery. Sometimes we need to use a temporary type of implant called a tissue expander during that process. If your cancer operation was performed a long time ago, or if you want to have larger breasts afterwards than you did before the cancer operation, or even if the tissues look kind of fragile at the time of the cancer surgery, we may need to use the tissue expander. The tissue expanders are very hard and they don't look or feel like natural breasts, but they're only temporary. If we use tissue expanders for your breast reconstruction, you'll begin the expansion process a few weeks after surgery. This gives your skin a chance to heal from the operation. At that point, you begin coming into the office every week or every 2 weeks, whatever is comfortable for you, and we'll begin the process of gradually inflating the tissue expander with salt water. Because the skin of the breast tends to be fairly numb after the mastectomy operation, this process shouldn't be painful. Once the tissue expanders are inflated to the size that you are happy with, we stop the process. At this point, we allow the skin of the breast to rest, usually for about 6 weeks, so your body can adapt to this new shape and size. Permanent breast implants can sometimes be placed at the same time as the cancer operation, and this can be a wonderful one-and-done operation for some patients, but not everybody is a candidate for this type of surgery. Whether or not the tissues appear healthy enough at the time of the mastectomy operation is a large part of how we decide if this is an option for you. Also, your goals for size after the operation will impact whether or not this is a choice that we can make for you. Breast implants can be filled with either silicone or saline, but even the saline-filled implants have a silicone shell, so all implants have some component of silicone to them. I don't recommend the saline-filled implants for breast reconstruction patients, however, because they tend not to look or feel as natural when there isn't breast tissue over the top to disguise them. Silicone breast implants are very safe. They are among the most studied devices in medical history. They don't cause cancer and they don't cause autoimmune conditions. That being said, they're still not natural living tissue. They will need to be screened regularly and followed to make sure that there aren't problems or cracks or ruptures in the implant. In our consultation, we'll discuss other options as well, such as what type of incision to use, whether we might use a specialty type of implant that's shaped or gummy bear, whether the implant goes above the muscle or below the muscle, or whether or not we need to use any specialty products like donated skin to supplement the reconstruction. It's very common that patients who have implant-based reconstruction need or want revision surgery. This may involve using liposuction to transfer small amounts of fat around the implant to soften the shape or disguise wrinkles. It may involve changing the size or revising scar tissue. I want you to be satisfied with your result, and so we'll perform revisions to achieve your goals.